Hi, my name is Elizabeth Rios. I'm a nurse practitioner and I'm also the project director for Cultivating Health Ministries. Thank you for watching this video. I would like to talk to you about hemoglobin A1C. This is one of the screening tests that we provide at your congregation or parish. What is hemoglobin A1C? Hemoglobin A1C is the average percentage of glucose in your body in the last 2 to 3 months. This number tells us how your sugars have been in the past 2 to 3 months. The higher the percentage, the higher the sugar levels in your body. This test, or A1C, can also be used as a diagnosis. When we do the screenings at your congregations or churches, we do not diagnose, but we can let you know approximately what that number is. It gives a good reading. It's in your fingertip. For a diagnosis, your medical provider will be the one diagnosing if you have prediabetes or diabetes. And a diagnosis is when a provider lets a patient know or tells a patient that he or she has a medical condition according to symptoms and signs, and also exams or testing or blood test. So it is important for a diagnosis to be done. It's important for it to be by your medical provider and using the blood test that the medical provider has ordered. Please take these screening tests that we have done at your congregation to your medical provider for him or her to be able to evaluate if there is a diagnosis of prediabetes or diabetes, and to do further testing and evaluation and to help you manage these numbers. Now, pre-diabetic range, as you can see in this diagram, pre-diabetic range is a percentage or number between 5.7 and 6.5. So if you get any number including 5.7 and 6.4, then you're at a range of pre-diabetes. If you get a number including 6.5 and above, the range is considered a diabetes or diabetic range. If you have diabetes already, then your percentage will let us know how you're controlling your sugars in the past 2 to 3 months. This is another diagram that gives us an idea of how the A1C, or the percentage, associates with your sugars when they're fasting, like here, and 2 hours after eating a meal, like right here. So for example, a normal range, like we said, will be below 5.7%. That means that your fasting blood sugars will be between 69 and 99, or below 99. And 2 hours after eating a meal, your blood sugar will be less than 140. And these are all normal ranges. A pre-diabetic range for a percentage or an A1C will be between 5.7, including 5.7 and 6.4%, which means that your fasting blood sugar test will be between 100 and 125 milligrams per deciliter. 2 hours after eating a meal, your blood sugar, if you're at a pre-diabetic range, will probably be between 140 and 199 milligrams per deciliter, like here. It can be lower. Some people who have prediabetes have their blood sugar 2 hours after eating less than 140, like 110, 120, and that's normal. These are ranges that we have when we look at your A1C test ranges. So it gives us an idea of how your blood sugars, how your blood sugars are. Now, a diabetes or diabetic range for an A1C is when it's 6.5, so including a 6.5 and above. So that means that your fasting blood sugars are 126 and above. 2 hours after eating a meal, your blood sugars might be 200 milligrams per deciliter or above. They could be lower, but these are ranges. So it really depends how your A1C percentage is. If your A1C is about 8% and you have diabetes and it's around 8%, that means your sugars are probably around 150, 160 fasting, and around the 200s after eating a meal. The best way to find out how you're doing and how you can get those blood sugars down to a goal or a normal range, according to whether you have diabetes or not, is to monitor or check your blood sugars. Now, please talk to your medical provider so they can provide and work with you, and they can provide a goal for you. So they will let you know what your goal for an A1C is. According to the American Diabetes Association, for a person who has diabetes, the goal for the A1C is 6.5 to 7%. It is also according to their age. So the older the person is, for example, if the person is above 80 years old, their A1C can be higher because we don't want to get those blood sugars too low. So please talk to your provider and ask him or her, what is my goal in the A1C? What are my goals when I check my blood sugars fasting and 2 hours after eating a meal? So this is very important for you to talk to your medical provider and set goals for your sugars. So normal ranges for those without a diagnosis of diabetes and who are adults are fasting between 69 and 99 milligrams per deciliter. 2 hours after eating a meal, less than 140 milligrams per deciliter. And if you live with diabetes or if you have diabetes, recommended ranges from the American Diabetes Association are fasting between 80 and 130, and 2 hours after eating a meal, less than 180. But please talk to your provider once again, because they will help you meet those goals. They will, if you have other medical conditions, if you have heart disease, if you are pregnant, all these numbers can vary and change. So it is important your medical provider knows you. And so they are able to provide individual goals for you. With these ranges for A1C and blood sugars. For example, if we look at this diagram, like I said earlier, if you have diabetes and your A1C is at 9%, that means that your sugars fasting are at 200 or above, and that's high. So the higher the number, the higher the sugars are. So then it relates or correlates your A1C with your sugars. How do you prevent complications? This is very important, and this is our mission and our goal. Part of our goal is to increase awareness about diabetes so we can prevent diabetes if a person has pre-diabetes, or if the person has diabetes already, we can prevent complications from diabetes. Talk to your medical provider, your nutritionist, and or a pharmacist to help you better manage your blood sugar levels and prevent complications. Know your numbers, check your sugars, and analyze your results. If your sugar is very high in the morning, what am I doing? What happened? Last night, did I eat a late big meal? I didn't exercise for the past few days. I haven't been drinking enough water. What is causing? I have been sick. So all these reasons can change your numbers. So it is important to check your sugars, but also to analyze why are they the numbers that they are. And so slowly but surely you should be going down on your levels and down to your goals. Exercise frequently. Exercise naturally gets those sugars down. Why? Because the insulin gets the sugars from your arteries and puts them back into your muscles so they can provide that energy so you can continue to have energy to exercise your brain so you can think, um, uh, your heart so it can pump your intestines. The glucose provides energy to all your cells of your body, and it shouldn't all be stuck there in the arteries. It should be all in the cells of your body and your organs. Take classes to help you manage your blood sugar levels. At Cultivating Health Ministries, we provide many classes that help manage diabetes, help prevent diabetes. And so please let us know how we can help you help yourself and help manage the blood sugar levels to prevent diabetes and prevent complications from diabetes. And take control of your health. You are the one, this is your life. You are able to manage and control your health. And we are here to help you. And thank you very much for being attentive. Please let us know if you have any concerns, any questions. Please let us know. We are here to help you. Thank you.